Franklin County Dog Shelter. I graduated from Ohio State in 1985. Brought some memories coming back here. Still didn't like to study. Saw some people having to do it. The only good thing about work is you don't have to do that. My wife, who is Dr. Nancy Hanaway, she works for APHIS, Veterinary Services in Pickerington. If any of you know who that is. If you decide you want a family, private practice isn't real good for that. So just know that there are a lot of government positions that kind of let you go that way. We met in vet school, we got married, practiced together for 19 years, decided to start a family, ended up with Lillian there, found out that private practice, even though we had a very, very successful practice, not very good for kids, so just decided on a September afternoon to ditch it. She got a job with APHIS, came down here to Columbus, her office is in Pickerington. Thought I would spend a couple years just goofing around, have never really not worked in my entire life since I was 12. My daughter, they found out, had autism, so that kind of put a little wrench in my plans. I really never thought I'd work again, but through the help of local services and me being me, got her doing good, and now she's a straight A student in the 8th grade, so kind of got her straightened out, went to just goof around, working at the old Franklin County Dog Shelter, which is certainly not this, was like a, oh God, it was really bad. It was horribly overcrowded, 300 dogs, it was only made probably for 100. It was like a field hospital in a war, just the amount of disease and type of disease. But the other thing about me is that I'm also a farm boy, so I also know a lot about herd health, and so that was very easy for me to go in there and straighten it out because I kind of know how to do those things, and kind of got that under control, was sort of made an offer to work for the federal government that I couldn't refuse, so I went to work for FSIS, Food Safety Inspection Service, as a supervisory public health veterinarian, and then as a district veterinary medical specialist. Because my wife was with APHIS, she's a pretty smart woman, and they wanted her to go to DC, so I figured, well, I'll go to FSIS, we'll both go to DC. She had told me it wasn't a good place for kids, went to DC, hated it, so came back to Ohio, and then the Veterinary Medical Director position opened, and so I came back, and here it is. It is the busiest shelter, certainly in the state, probably in the Midwest. We're not a no-kill shelter. We're also an open admission shelter, which means we have to take everything regardless. We do see 12,000 animals a year, and we have to basically take care of all of those 12,000 animals. Any given time in the shelter, we have between 175 and 275 animals each day. So like I said, if you are a large animal person, shelter medicine is a real good fit for you because that's what it all is about, is herd health. The good thing is that, well, we're a little unrealistic because we have lots of money. Most shelters are nowhere near as what we have and we're able to do. So that's kind of a luxury, but it's also incredibly interesting because not only is it herd health, but I mean, just this week we were able to send a dog for a CT scan at MedVet. We were able to have bilateral radial ulnar fractures on a little 6-pound puppy fixed by Dr. Barnhart, who is probably one of the best orthopedic surgeons in the country. Bladder stones removed from a male dog that are, if you guys ever get out there, it's a pretty difficult thing to do. That was also taken care of at MedVet. And we are just sending a dude for an olecranon fracture to have him scoped and get that taken care of. $10,000 for those 4 procedures. So we're lucky that we have the ability to do that. Certainly most shelters don't. And then on top of that, we got to keep everybody from getting parvo, giardia, kennel cough, all that other good stuff. So it's something, I was just telling the person, I mean, I get up at 6:30, in the morning. I don't get home till 7 or 8 o'clock at night. I'm on call 24/7. I work every day except Saturday. Sunday is sort of my catch-up day, and I usually spend 7 to 8 hours at the shelter then. Not only do I take care of all the animals, I also have administrative duties. I have 5 techs I'm responsible for, who are in turn responsible for 20 kennel attendants, so they kind of fall under me as well. Plus, we have, if any of you ever heard of SOS Surgical Unit, they have their own place, but they also do the surgery for us because we just don't have time to do that as well. They have 4 doctors and 3 vet techs and assistants, and I oversee them as well. So we have a lot going on all the time. It is 46,000 square feet. If none of you have been there, it's really something to see. Let's see if there's anything else. Although we are not no-kill, any dog that can pass medically or behaviorally will be put up for adoption, but they have to pass medically and behaviorally. We get these dogs in, we don't know nothing about them. Within 3 days, no history. We have to make sure that they're medically sound, behaviorally sound, and that when they hit the adoption floor, they aren't going to come back for either of those problems. And we are pretty good about that. I get to spend maybe 5-10 minutes to make that determination, and we do a pretty good job, I think. I think last year I had one dog come back. It was a dog with a nasal carcinoma that actually developed after it was adopted, and we went ahead and took care of it. That's when we sent to MedVet for a CT scan. But that's what we're dealing with, is dogs that we don't know nothing about. Not only medically, we say medically, orthopedically. We have a digital x-ray. Any big dog is given a hip rad. When dogs come out of there, there's nothing wrong with them. If they are behavioral and medically sound, it doesn't matter what the problem is, we will get them fixed to have them proceed. Let's move on here. Anybody have any questions? Yeah, I really don't care. I'm pretty easy, so if anybody has questions, ask away. That's just the lobby there. We're split. We have the lost dogs coming on one side, we have the adoptions on the other to keep the disease separate. We have 43 real life rooms, which are these nice big rooms that we put all the dogs that are having a little bit more of a hard time moving on. So they get probably a 5x5 area. These rooms are kept immaculate. And as you can see, they get pretty nice bedding. They absolutely have to be kept clean. That's part of my job. And then on top of that, we also have 4 adoption wards that are stainless steel. Each holds 25 to 30 dogs. So that's what that's all about. And that's how we keep disease down. It's all about sanitation. That's it. Sanitation, early disease recognition. We could euthanize 5 to 6 dogs a day for parvo coming off the wardens' trucks. The wardens, we have 3 shifts of dog wardens. They run 24 hours bringing us dogs. We can easily have 5 to 6, up to 10 dogs coming with parvo a day. They'll bring the healthy dogs with them. They have no way of knowing. And so we have to be able to bring them in, put them into the lost areas of the stray hold for 3 days to give people a chance to find their dogs, get them to surgery, get them to the adoption without them getting parvo. And we haven't had a parvo hit the adoption floor in probably 4 or 5 months. And that's handling 200 dogs a day. So I think that's pretty good. We just had, I don't know if you guys follow anything, we just had basically a person was arrested for drugs, had 47 pit bulldog mixes. That's what we were just dealing with. The guy, he's a drug dealer, but you can't blame the dogs. We only allowed 10 pit bulls on our adoption floor at a time. There's nothing wrong with pit bulls, but we only put up adoptable dogs, and they're not exactly, unfortunately, adoptable to a certain extent, so we can't just have, if we put up every pit bull, we wouldn't have any room for other dogs. We ended up with 47 of them, and we decided, well, the director decided that we were going to do something or try to keep all of them. We do have rescues that we work with. I think we ended up, a couple of them behaviorally we just could not keep. They weren't safe. But I think that was only a few. gentleman was able to take a few back. And so after they were in the shelter for a week, they decided to develop Giardia, which we had to close down a whole ward because of that. And I was just talking to the director, within 4 days, we had every dog with Giardia settled, did not go anyplace else in the shelter, which is really excellent. I don't know if any of you guys know about Giardia, but it is potentially zoonotic, so you can get it too. So when you're playing with poop, you should wash your hands. You do not want to get Giardia. Supposedly there are different types. Dogs go to dogs, people go to people. But if you ever go to a meeting on it, nobody seems to know anything. But at the old shelter, when we had 300 dogs, we could have 40 with Giardia blowing on the floor. So we don't want to go back to those days. We have a very nice isolation area for kennel coughs, and then we have a separate area for Giardia. So by the time we had to close down a ward, get everybody where they were going, get them treated, it took about 5 days, but it did not get anywhere beyond where it needed to. They're just getting ready to put in a, oh gosh, I think $10,000 indoor-outdoor track for the dogs to be walked on. Try to get them groomed. Of course, that's a little bit difficult before they hit the surgery because we have to hold them for the 3 days. We don't really want to waste our time grooming a dog that's going to get redeemed. But we also want to take it easy on the surgeons and not have them to have to work in crap and fleas. So we try to get that taken care of without giving them a disease like parvo, Giardia, or kennel cough. Like I said, the lost and found and the adoption are kept separate, and that's what makes everything and all the dogs happy. We actually have a really small area that we work in, but it's extremely efficient. Basically, what we do when a dog comes into the clinic, just to kind of give you an idea, I mean, that is the time we look to see if that dog has any orthopedic issues. I mean, I get a chance to see it coming towards me and leaving, and you get pretty good at it if you do it enough. If any of you guys, when you get to vet school, pay attention to equine, that's how you learn about lameness, okay? I mean, you'll learn more about bandaging and lameness in equine, hopefully, if they have a few horses over there, than you ever will in small animal. Cattle, you'll learn about herd health, like I said, if you decide you want to be a shelter vet. So what we do is the dog comes in, get to see it walk real quick, and you wouldn't believe the stuff that comes in and what we see. We have to get a good weight. We have to check them for a microchip. I never microchip my own dog, but if you guys have a dog that ain't going to stay home and you want to get it again, unless you don't want to get it, then definitely get a microchip. It is worth it. We scan dogs 4 times to try to find it, and if we find them, we will get them home to you. We get a temperature, of course. We try to not bring sick dogs in, but you never know. A parvo can slip by, so we always have to be very cautious of that. They get a heartworm test. We do have the ability to treat some dogs that do have heartworm, kind of special cases, but we do have the money for that. And it's not so much the money. It can take up to 6 weeks to 6 months to get one treated, so it's more just the time than anything else. Things you would never think about when you get into practice or when you guys get into vet school is, how old is a dog? I mean, that is a huge part of what we do. We have to have accurate ages. So we look at teeth, we look at eyes, we look at general condition, size of the genitalia. And we got to make that decision right now, because if the dog's going to rescue, if it's over 7 years, we have to do blood work on them. Although it seems silly, when I was in private practice, everybody knew the age of their dog. Getting into this is a whole different ball game. And same thing, something as silly as whether a female dog is spayed or not. The SOS vets, they make an incision that big in every size dog. And so trying to track one of those guys down to not put a dog through surgery unnecessarily, it takes a lot. Every dog we take a look at, we have to auscultate them, because what we do right here and then, that says they're going to surgery and they're going to live through it. So that's kind of important. We do a standing ortolani. If any of you guys know what that is, that's what you do to check for hip dysplasia. We have to know right there and then. We would not put a dog up with hip dysplasia. We've kind of developed a technique where we can do that from a standing. When we're doing that, not only do we check their hips, we check their knees for cranial cruciate ruptures and for luxations, whether it's medial or lateral. If it's less than a 2 of 4, 3 of 4, 4 grades is it. Sometimes we can get away without doing anything. If it's a nice enough dog, we'll take and get them fixed at med bay. Let's see what else we do. Of course, if they're over 7 years, then we do blood work on them. Not only, so we do the blood work, we send it, we get the results the next day. We do not have in-house blood, which that's okay. It gives me a little bit of time to get a little break before we have to move on, and that's just something that I don't have to do. If everything looks good, though, and we get them set up for surgery, then on surgery days, we get to x-ray them. Usually on the geriatrics, we want to do a chest, abdomen, and pelvic x-ray. Because we have the digital x-rays, we can do it all in 5 minutes, which a lot of private practices don't have. So that's what I do when we do a physical. As far as how my day starts, I get into the shelter before everybody else. I make sure my room is clean so I don't have no parvo. We have a computer program that's, I don't know, I guess we live with it now, but it's called Shelter Buddy, if any of you heard of it. I don't know if any of them are any good. But it does make reports for us, so we have to do certain reports. Holding vet cares or dogs that we're working on, waiting vet exam health checks are ones that we're going to look at that the vet techs, when the dogs came in, think that they're good enough to go up to the adoption floor, or I need to look at them for rescue. And then we also have the vet reminder list, which every dog that a vet tech thinks or anybody has an issue, it has to be settled by the end of the day. So we do that when we first get in. As soon as I get that settled, I take off and do a walk on the adoption floor. We try to keep clean and dirty, so I try to do all my adoption side first. I personally check every dog on the adoption side. Once again, we're looking for parvo, kennel cough, and giardia. Any vomiting, diarrhea, we don't wait for bloody vomiting, diarrhea to find parvo. If a dog's not eating, we pretty much know. I have 5 techs. We have, like I said, 10 to 20 kennel attendants, and those people do a great job. We rarely have a dog with diarrhea. We can usually tell just whether they're not eating just by the look of them, or if they have some vomiting, so we can get them out of there before they're blowing diarrhea and contaminating everything. So we do a quick walkthrough with that. As soon as we get that done, probably of the 120 dogs up for adoption, 40 of them will be on meds. So we have to go, even though it's all in the computer, we still use treatment cards because we have to have a way to treat 100 dogs all at one time, and that's what pretty much gets done 2 to 3 times a day. Go through that. Any dogs that their treatment time is up, we want to get those guys checked. After that, we have a list of dogs that I get with the behavior people, and then as far as shelter medicine is concerned, I pretty much follow UC Davis Correct Shelter Medicines program. So if you guys are very serious about shelter medicine and you want to know the latest information, they're the ones. I mean, anything you want to know, any of the most current thoughts, processes. Dr. Hurley wrote the book on shelter medicine. She's the person out there. And so that's kind of what we follow. So in that vein, part of their program is that every dog is to be assessed every day, and not necessarily by the doctor, but that's what happens. Me and the behavior people, we go through on the shy dog or on the stray hold side, and we check every dog, not only behaviorally but medically. I mean, if a dog's not medically sound, I'm not going to waste the behavior people's time. But if the dog can go to rescue, which we have lots of rescues, so a lot of dogs do get out that way, but they have to know everything they can know, so they'll take the dog. So we spin through that, and then we start doing this after all that. When we're done clinicking, then usually that's about 5 o'clock, my help leaves, and then I kind of finish up things, call people I got to call, and then I do a walkthrough on the stray side, which is the dirty side, and I check every dog again. And that's how we keep bad things from happening there. Any questions? So I start about 6 to get going, 6:30, get home 7, 8 o'clock. That is my day. If a dog has an owner, gets hit by a car, they get the same emergency treatment that they would at your emergency or at MedVet. We'll keep them alive. We have the ability to do it. These are just some of the dogs that, gosh, 5 years ago, these guys would have been euthanized, or somebody was nice enough that they would have them paid for. But this guy, if you can see, as I was explaining to people today, when you're looking at x-rays, you always look at the whole thing, and you always want to make sure everything is smooth and no lines are broken. You always want to compare one to the other. If you noticed over here, you can see that defect right above the patella. So this guy had an old femoral fracture distal. His name was Abercrombie because Abercrombie and Fitch paid to get him fixed. Friends of the Shelter, this is our nonprofit organization that pays for all of this incredible work. And so these are some of the other ones. This guy is particularly interesting. That is his foot, and somebody decided to splint that, so there's 2 pieces of wood and a bandage. You can see the wood sticking out there. When I took that bandage off, I bet you 500 maggots fell out of it, and I thought that dog's foot was going to fall off. But they were able to reattach it in his foot, so I'd never seen that before, so I thought for sure. But you can see where he'd been chewing on it. It was all swollen from adding the blood, and it was fractured to boot. So that's that guy, and he went on, and you can see that tibial fracture on that little dude there. If you look at the top x-ray, the left is all good. You can probably see the tibia. The bottom bone is broken in half, and he was another guy that was taken care of. And like I said, that's crazy that we're able to do that. I believe Daffodil was a dog. We also have, well, it's good, but it can be a little hairy. We also have an off-site veterinarian that if we do get dogs with parvo, if they seem like they're okay behaviorally and medically, they will have them treated off-site. Not a good idea to treat parvo at the shelter or anywhere, to be quite honest. I don't know if you guys know, parvovirus can be in the environment for up to 6 months. It is not worth keeping one dog to have other dogs get it. But we're pretty fortunate. That was initially set up to just take care of parvo dogs that went to the adoption floor. But now that we've got the shelter running properly, we flow from dirty to clean. That's pretty rare. So puppies coming off of the warden's trucks actually get a chance to go get parvo treatment. Behavior assessment, when I started there, we had a part-time person. Now we have 2 full-time, and they do an excellent job. I don't have quite as many scars as when I started because they're kind of a little bit more choosy. 25 to 25 surgeries a day. SOS does the surgery. We do all the pre-op, post-op. Let's see what else we got here. Getting ahead of myself. The other thing we do have at the shelter is we do have a shy dog program. So dogs that do not pass behavior initially, they have the ability to be worked with by volunteers to make them get ready to go to the adoption floor. Dogs cannot bite somebody on the adoption floor. It used to be those guys were just euthanized. Now we have about 7 to 10 dogs in that program all the time rotating through, so we get all those guys up as well. And that's worked out very well.
Dr. Morton?
Yes?
What's the success rate with that program?
Well, pretty high, but they have to be dogs that aren't going to bite the volunteers. So we have some very experienced people that can pretty much tell. The good thing is, or the thing that we have, is that the shelter, if you guys have never been there, even though they are runs, I mean, they're shoreline stainless steel 2-sided runs. I mean, it's as nice as it can be, but it can still be pretty loud. And if you got a poor little puppy that's, I mean, it can be a pretty scary place. But those dogs, if they're stray, I mean, they're there for 3 days. So those guys get looked at every 3 days by me and the behaviorist. And you can tell if they're breaking or not. You know what I mean? If they're going to snap out of it. So once we're sure that they're not going to eat somebody, that's when they can go. So rarely do they fail because we're picking the guys that we know aren't going to. But they get 3 looks before we would say, you're not going anywhere. Okay? Yes, sir.
When you say the shelter is running effectively, what were some what was implemented to like from the previous, how it was previously run to?
Well,
allow it?
so when I got there, unfortunately, this shelter, basically they took the old shelter and all the bad habits and brought it to the new shelter, which drives you crazy. This shelter, well, shelters are designed just like any herd health smart, I mean, I think you don't have to be, well, I shouldn't say that. You do be, I guess you do need to be knowledgeable. Basically, just to give you an example, is that the dogs from stray hold, when they had surgery, after they had surgery, they went back to where the other stray dogs were instead of moving up to the adoption floor. So you went from dirty to clean, back to dirty, and then took that dirty dog and put over the adoption. They could have 10 dogs breaking with parvo in the surgery room. I mean, in the surgery room. So, disastrous. So one of the first things I was just like, you gotta be kidding me. And that's how the shelter was meant. Basically, it was meant you have the stray, you go to surgery, and then you go to a nice new clean place. And so that was the biggest thing we did right away, was get that settled. Then I went and said, okay, I mean, our cleaning staff, we use Virkon, if anybody knows what Virkon is, kills everything, actually works in organic material, is stable for up to 2 weeks. But if there's crap in there, it's not going to get in it. So kennel staff said they knew how to clean. I went and watched them, they didn't even know how to fake it. So they told me they weren't going to get into trouble, but after that, we got everybody cleaning properly. I mean, and you know, just doing the right thing. I mean, it's as simple as that. Virkon is incredibly effective, but you got to use it and you got to make sure it's clean. So the biggest thing is just moving from dirty, clean. That's one of the biggest issues. The other thing is, I mean, when I first got there, dogs were dying in the stray hold side because nobody was paying attention. I mean, and that's just unacceptable. I had techs tell me that you're going to euthanize the wrong dog every once in a while. No freaking way. So that was kind of the attitude that was there. So kind of got a watchdog on them, and now. So a year ago, I took over. So I got there, I spent a year getting the medical all situated, and then they're like, okay, now you get to be the supervisor of the kennel attendants, or of the techs, as if I didn't have enough to do. But since that's happened, now everything is good. Not only do we not have, I mean, at the old shelter, we had dogs dying of kennel cough. I mean, totally unacceptable. Our kennel cough area holds 7 dogs. We'll maybe have 2 now. But a lot of that's just early detection. You know, I mean, you got to be out there, you got to be watching the dogs, you got to know. So that's what we do. Did that answer your question? Anybody else have any questions? Yes?
What are the special cases that you treat heartworm?
Really, as long as they're under 7 years and they're not going to eat somebody, they can take being caged for that length, you know, I mean, and the person that does it for us, she does follow the Heartworm Society's recommendations. You know, you can't get doxycycline anymore, if anybody knows what that's all about. You know, it used to be 3 cents a tab, now it's $1 a tab. I mean, that's what not only did we use for kennel cough, that's what was recommended to treat dogs with heartworm so that they didn't get secondary issues. So now we use minocycline, which it works well, but I mean, that was just something, I mean, was that 2 years, or probably 18 months ago? I mean, not having doxycycline to treat kennel cough, I mean, that was just devastating. But I just use it as an excuse to everybody do their job. So by getting everything cleaned down, we don't treat 25% of the dogs we used to just within the last year, just by getting them moving. The other big thing we do is that because I work with the behavior people who also are the rescue people, we could easily, the other big thing, if you want to check out correct shelter medicine, is length of stay article. I mean, if you don't want disease, if you don't want dogs to go crazy, the shorter time they're at the shelter, the better. So that's why I took it upon myself to check the dogs, go with the behavior people who are also the rescue people. We could have dogs there for 20 days. I think now the longest stay is 8 days. So that really makes a big difference too. As nice as it is, it's not meant for dogs to live there. I mean, that's the bottom line. It's just not right. If any of you guys have ever, I mean, even a dog that's kennel, that's a pet, I mean, after 2 weeks, man, it's hard for them. So if you get a dog, I mean, our hardest dogs are, you know, 8, 10-month-old